Please put on your cameras. Hi, everyone. Welcome to Ask the Pediatricians, our first symposium for our annual online conference, day one. I am Dr. Boyede. Going to be introducing our guests to you shortly. We've got a full house because we're having symposium. The theme of this conference is Holistic Child Care in the 21st Century. And so this is our 6th anniversary, and we're talking about the child. And we want to talk about how can we make our children, how do we care for them? How do we make sure they are healthy in this 21st century? So we've got so many professionals here today. And so you're all welcome. For what you want to do for us, please share the video and just share the video for us and let people know we are live now. And so just share the video and let people start to join. Shortly, I'll be introducing my guests to you. But for now, I just want you to just share the video and let everybody know we are live. I don't know whether any of our moderators are watching. If you are watching, I would like you to help us to pin this to the announcement section. Let it be up there so that people can easily see it. And so the way the format is going to take is that we're going to listen to all the panelists, and after that we're going to now ask you to ask questions. So we've got all the various professionals, and I'm going to introduce them one by one to you. I think I'll read their profile shortly before they speak so that you don't get lost in the middle of it. All right, so feel free to start dropping your comments for us so that we know you are there. I can see some comments are coming in. So if you are watching, please let me know you're watching, and then I'm going to introduce my guests to you one by one. So I'm going to ask each of the guests to unmute themselves and introduce themselves to you. Yeah, so let's start with our occupational therapy. I'm going to go in the order in which we are all showing on my screen. So, Mr. Samson Dreja, can you just introduce yourself to us 2 seconds? You can unmute yourself. Yeah, unmute. Okay, so let's go on. Okay, Dr. Rotimi, can you introduce yourself?
Good evening, everyone. Good evening to you, all our members out there. My name is Dr. Rotimi Adesanya, a family physician and ATP family admin and ATP National Outreach Coordinator. I want to welcome all to the 6th anniversary. I pray that we have a wonderful time together. Thank you.
Thank you so much, Dr. Jumoke. Okay, Dr. Jumoke just disappeared, so I was about to tell her to introduce herself. Okay, Patience, you want to introduce yourself?
Good evening, everyone. I'm Patience Olaiya. I'm a speech therapist.
Welcome, Patience. Thank you. Yeah, Sandra, you want to introduce yourself?
Good evening, everyone. I am Ibeh Tony Sandra, a registered pediatric nurse, and also a volunteer for Ask the Pediatrician. You are welcome to ATP 6th anniversary celebration. Thank you.
Okay, I don't know where the echo is coming from, but I'll just say, when you're not talking, can you please mute your mic? Just mute your mic if you're not talking, because we're having lots of echoing. Thank you, thank you so much, I'm a professional. We're still getting some echo. Please mute yourself if you're not talking. Okay, don't worry, I'll mute you. Okay, let me unmute Tinyan. Tinyan, can you introduce yourself to us?
Good evening, everyone. My name is Tinyan Oghide, and I'm a pharmacist, and an entrepreneur.
All right, thank you. Dr. Jumoke. Dr. Jumoke, can you hear us? Okay, we seem to be losing touch with Dr. Jumoke. All right. What about Samson? Let me unmute you. Then you can introduce yourself.
Yeah. Can you hear me?
Go ahead.
Can you hear me?
Yes, we can hear you.
All right. My name is Durojaye Samson. I am an occupational therapist. I work with kids with special needs. I study in Nigeria, Federal School of Occupational Therapy. Currently in Oshodi, and I go to India to study my bachelor, and I did my master also in India. And I work with kids with special need, and I registered with Medical Rehabilitation Board of Nigeria, and also a member of All India Occupational Therapy. And I
all right, thank you, Samson. Thank you. We'll still give you more time to tell us about yourself. Dr. Jumoke, are you able to introduce yourself now? I'm not so sure Dr. Jumoke can. You mute yourself, so you need to unmute yourself, because I tried to unmute you and it was kind of difficult for me to do. So you have to unmute yourself to talk. So I'm still expecting Dr. Olatosi and Dr. Okay, I think Dr. Olatosi is here now. Dr. Olatosi, if you can hear me, just talk. Still expecting also a physiotherapy. So today we have so many professionals that are involved in care of children with us, and so each of them are going to talk to us and tell us about what they do in terms of making our children to be healthy. So that is what we are going to do. Dr. Buki, do you want to introduce yourself to us now? Dr. Buki, can you hear me?
Hello.
Hello, yeah, please go tell us about yourself. Okay, we can't seem to get Dr. Buki to talk. Dr. Buki, can you hear us? Okay, she seems to be hanging. All right, just 1 minute. I just want to pin the video itself. Okay, because of time, and since I'm struggling with some of our professionals, I think we'll just start with those who are available, and then we can obviously, hopefully the others will get them sorted later on, and then we can get it. Tinyan, it would be nice if you face your light. I can't see your face, it's so dark. You need to face your light so that it will be bright. Yeah. Okay, so we will go. And so today we're talking about holistic child care. And today is the health panel. So we have all the health professionals here going to tell us, because people think when we talk about health care, we're talking about only the pediatricians. And I just want you to realize that that's good, Tinyan. It's better now. I just want to realize that it's not only the pediatricians that are involved. The care of our children is a multidisciplinary. It involves so many professionals. It involves even people who are not healthcare professionals. So today we're going to be talking about how do we take care of our children, and we have at least 10 of the healthcare professionals being represented here. I'm the host and I'm the moderator, but at the same time, I'm also representing the pediatricians. So that is what we are doing today. Hopefully, we will get all our professionals to get us at the end. I want Dr. Jumoke to talk first, because we all know that the life of our children starts from the womb. And so each professional is going to talk to us for about 10 minutes. If you have questions, please put it in the comments, but we are going to take all our questions at the very end. So if as they are talking, take note of your questions. You can put this in comments so that you don't forget, but we will eventually go back to them at the end. So don't worry about it. But we want the professional to talk to us first, briefly for 10 minutes. Please, today is not the day to ask questions about my baby is this, my baby is that. If you have any question like that, please post to the Facebook group. I know some of you are from ATP Live, usual Monday, where you ask all kind of specific questions about yourself. This is a broad spectrum symposium. We're going to talk about, if you don't know, some of you don't know some of these professionals, some of you don't know what they do. So this is your opportunity to know that these are other professionals who are involved in the care of children beyond the pediatricians. And so please listen to them and ask questions about what they do or how they can help your children, but not specifically like my baby is coughing, my baby have diarrhea. We are not going to take those kind of questions. So if you have those kinds of questions, just post on our Facebook group and we will answer them later on. All right, so let's start with our gynecologist obstetrician, and that is Dr. Olajumoke Ogunro. I'm going to just read a profile briefly. Okay, so Dr. Olajumoke is a consultant obstetrician and gynecologist. She's been in obstetric and gynecology for the past 15 years.
Good evening.
Yeah, good evening, welcome. And then, so she's also an author of the book 9 Months and Beyond, which I'm privileged to be one of the contributors. I contributed the newborn part, and I can tell you it's an amazing book for everything about pregnancy. And Dr. Olajumoke also writes, she blogs on the fertility facts. So she's into fertility and all that. So the care of children, people think our care of children starts when they are born, but it actually starts before they are born, and that is where the obstetrician gynecologist come in. So let's welcome Dr. Olajumoke. Oh, Dr. Olajumoke has disappeared. Okay, I was going to welcome Dr. Olajumoke to tell us about what she does, but she seems to have disappeared now. Okay, so what I'll do is to leave Dr. Olajumoke. And let's go to. Okay, no, she's back. Let's wait. Okay, Dr. Olajumoke, are you with me now? We're sorry. Sometimes this is technology, internet, network. There are a lot of issues. You're having difficulty with Dr. Olajumoke. I think I will go first, and then we'll go to the family physician, because I want us to do it in the order in which we appear in the child's life. So, and that's why I want Dr. Olajumoke. Dr. Olajumoke, are you okay? Dr. Olajumoke, you can go on. Give us your talk. I want to. Okay. All right. I think I'll just go first, since Dr. Olajumoke's connection is not very stable for now. All right. So usually the obstetricians take care of the babies in the womb.
Okay.
Life does
Good evening.
okay.
Good evening, everybody. Can you hear me?
Yeah, okay, we can hear you now.
Okay,
Go
so
on.
good evening, everybody, and happy 6th anniversary to all of us. And thank you again for having me. Can you hear me?
Go on, go on, go on.
Hear me?
Yes.
Can you hear me? Oh no.
Yes, yes.
We can hear you, ma'am.
Can you hear me?
Yes. But you seem to be fading out. Okay, so let me just go first because I think Dr. Jumoke internet connection is the issue here. Okay, so the Dr. Jumoke is going to come back and tell us what they do as obstetrician. I was just trying to say that life does not start when the baby is born. Life starts when the baby is conceived, and that is most people, we don't know when that happens. That is the truth. No doctor, no pediatrician knows when the baby is actually conceived, but that conception happens when the sperm, which is the male reproductive cell, meets the egg, which is the female one, and comes together to form what we call a zygote, and that is what we divide severally to become a whole human being. And so, and all that happens in that womb is part of that person's life. So everybody's age is actually whatever age you have now plus 9 months. So pregnancy is very vital, and that's what Dr. Jumoke is going to talk about. I'm a pediatrician, you all know me, so I don't need to introduce myself. All right, so you all know I'm Dr. Gbemisola Boyede. I'm a pediatrician. I'm actually a neurodevelopmental pediatrician, and I also the founder and the CEO of Ask the Pediatricians Foundation. Now, you all know what we do on Ask the Pediatrician. So the job of the pediatrician is to take care of children from 0 to 18 years. And that is why you see us always asking you all the time to tell us the age of your child, because we manage children from birth till they are 18, and then we pass them on to Dr. Rotimi, who is our family physician, who actually takes care of everybody from womb to the tomb, but we are the specialists only for the first 18 years of their life. And what do we do? So people used to make a lot of things like, oh, if they are not sick, the doctors will not have work to do, or they will not earn money. How will they survive? And I used to tell them that pediatricians, we are one of those group of people that you don't need to be sick to be taken care of by pediatricians, and we have enough work to do taking care of healthy children. And so it's not just about only when children are sick, because the best thing to do is to make sure that children are not sick, and that is where we come in. So we take care of the babies. So there are things that are done usually when the babies are born. The first 1 hour of life is the most dangerous, the most precarious hour of anybody's life, because that is the time that will decide whether you are going to stay or whether you are going back straight away. So the pediatrician is very important at that point. Actually, if the pregnancy, most babies are born crying, no problem, we are grateful. But there's 1% of babies that will be born not crying, and we have to resuscitate these babies to make sure that those babies don't go back straight away in that first hour of life. So the pediatricians were there to resuscitate the babies. And after they are born, we encourage the mothers, we examine the babies. Most of you have your children in hospitals where they don't examine your babies. It's actually wrong. There's what we call baby check. We need to make sure that the baby's hands are complete. We actually count the fingers, we count the toes, we check all the body parts and make sure everything is fine. Hopefully, most babies are born without any abnormalities, and they go on to just, where we tell you how to keep them healthy, exclusive breastfeeding, immunization, and of course, you need to bring them for regular checkups to make sure that they're growing well. And of course, when the children are sick, it's our job to figure out why are they sick, and it's our job to make sure that we treat them. So we treat them properly. And of course, for children that have other issues, depending on different organs of the body, Each organ of the body also has its own specialist pediatrician. So children with the heart has its pediatric cardiologist, the brain, we have the neurologist, or even development of children, we have people like neurodevelopmental pediatrician, even the GIT, the stomach, the liver and all that, they have the gastroenterologist. So we have different specialists for different organs of the body if there's any issue. Even the skin, we have the dermatologist. So these are all the various specialists within the pediatric, when we say pediatricians, take care of children, but inside that pediatrician family, we also have different specialists for each different aspect of the body. So that is the job of the pediatrician. So then people always ask, is it like anytime their children are sick, must they always see a pediatrician? No. There are other doctors that can take care of your child. Dr. Rotimi will talk more about that. But when they are really ill, in different countries have different protocols. So for example, in countries like the United States, all children must have their own pediatricians, and every child has a pediatrician who takes care of you from the time you are born to you are 18. Some countries actually make it 25, but most countries will say from 18. Nigeria is 18, in UK is 18. And then outside that period, then you go on to the adult physician and the family physicians, and so that is basically what we as pediatricians do. And so even though you don't necessarily need to have a pediatrician, depending on which country you live, but if the general doctor, the family physician sees you and think that this case is more than just the something that they can handle, then they have to send you to the pediatricians who will take care of your baby. So it is not every cough or catarrh that must land on the table of the pediatrician, but majority of cases is better handled by pediatricians. And then there are special babies that need to be handled by the pediatricians. For example, if your baby is a preterm baby, a baby that was born before 37 weeks of pregnancy, that baby must be monitored, followed up by a pediatrician. Okay, if your baby has any complex medical condition, asthma, cardiac problems, or all those special issues, then a pediatrician needs to be involved in the care. And usually sometimes children have complex health issues and they need to see so many different doctors. It's better a pediatrician is involved as the coordinator, because the pediatrician is not just interested in the baby's problem. We're also interested, is the baby growing well? Is the baby developing well? And other doctors, because they are not primarily trained as pediatricians, they just focus on their own primary area. So the orthopedic surgeon will only focus on the bones and the legs, and they may not even bother whether the child is eating or growing and all that. But a pediatrician who is coordinating will make sure that everything is being done properly. I don't know whether I've said my 10 minutes, I think so. So basically that is what we do as a pediatrician. So it is not just about when the child is sick. Before the child is sick, we are there, and we're there to promote also the health of children. So that's all that we do for our children. Thank you so much. All right, so now we're going to go on to I don't want to talk too much, because I think for among all these professionals that are here today, you all know more about the pediatricians than any other person else. So I just want to leave that to that. So let me give it to Dr. Rotimi now, because I can't see Dr. Jumoke. And so let's pass on to Dr. Rotimi. Dr. Rotimi, you want to tell us who a family physician is, but before Dr. Rotimi talks, let me just quickly give you a brief about him. Some people are coming in and out. I think it's the internet network. Okay, so Dr. Rotimi is a consultant family physician. He is also interested in medical missions, child health, and public health. He's a prolific columnist. Some of you that read what they call it, the health segments in Punch, I'm sure you must have crossed across Dr. Rotimi write-ups over the years, 17 years experience, and he's also into family planning. He's a member of ATP, as you all know. He's one of our national directors, and also a member of Society of Family Physicians of Nigeria. So Dr. Rotimi, you're welcome, and thank you so much for being on our panelist today. Can you just tell us what the family physician does? Thank you.
Thank you very much, my founder, for the wonderful introduction. I want to say happy anniversary to all of us once again. We are 6 years today. We thank God for the grace and for how He has seen us through. We started little, but God is doing great things in our life. We thank God for that achievement. So today I'll be talking on the role of family physician in holistic care of children in the 21st century. As you all know, we are in the 21st century, and I will start with who a family physician is. A family physician is a multi-competent doctor, who provide comprehensive care and continued care for everyone, irrespective of the age or sex or religion or tribe. We take care of everyone. And we used to say this, that from the cradle to the grave, we start seeing patients from the cradle, from birth, to the time they are exiting, they are taking their last breath. So that's who a family physician is. And we are normally the first contact doctor. We are everywhere. We are in the grassroots. We are in the local government. In short, in the primary health care, the doctor that normally head the primary health care team is normally a family physician, because he is rounded in most of these specialized area, at least to some extent. We say that we see 80% of the cases, and we refer the remaining to the real specialist that owns the patient. As primary physician, we are also into domiciliary service. Is in our curriculum, domiciliary service, whereby, after seeing the patient in the hospital, some, due to one inability to the other, we take it further by seeing them, in their home. It's covered under the family medicine. So as far as we are concerned, like I said, we are first contact doctors. We start from the primary care. In relation to the children, I must tell you, let me use Nigeria as an example. After a pediatrician have resuscitated the baby, they have made sure the baby is stable. After the first 1 week, and they have handed the baby over to be going for immunization, at the primary health care center, it's actually the matrons, the nurses, that give the immunization, and the person that is closest to them in those primary health care are the family physician. So we advise, we give them advice on immunization. So partly we are involved in the immunization of our children up to the adolescent age, up to their teenage age, where when they are teenagers, when they start taking this cervical vaccine, we are involved in all those. And also at the community level, as family physician, we are extensively involved, especially in this 21st century. We are involved in the child survival strategy. Like I said, after the pediatrician have taken care of resuscitated the baby, they are sure the baby is okay, baby is released to be going for immunization, and all those things that are involved in child survival strategy, like growth monitoring, the nurses that do it, are under our team. The nurses that, educate on oral rehydration, breastfeeding, immunizations, we co-work with them. We work together. We guide them on what, on the updates and the latest thing to do. And much more than that, we family physicians, the other part of child survival strategy, like female education, we are extensively involved. They normally say that when you train a woman, when you educate a woman, you educate a nation. We are extensively involved in that. We educate our women on hygiene, how to take good care of themselves, how to wash their heads, and how also to empower themselves according to the SDG, Sustainable Development Goals. So we are extensively involved in that. And also, as part of the child survival strategy, we have what you call food fortification. We encourage these mothers, especially the ones that are nursing their baby, the nursing mothers. We encourage them how to fortify their food, by getting iodized salts, getting some food that have been fortified with vitamin A, and also our mothers, after they have delivered in the first 6 months, we are involved in giving them vitamin A so that the baby can also get part of that vitamin from them. Things like tetanus toxoid, we monitor it even after they have delivered. We monitor it and ensure that those tetanus toxoid are fully taken so that we not have problem in the community. Things like essential drugs, especially for the mothers and our children, we are involved in it. Like Dr. Gbemi have said, that a pediatrician doesn't see all the cases. Things like malaria in the community, things like cough and catarrh in the community, diarrhea in the community, we are extensively involved. We see them on a daily basis. We don't want our pediatrician to be overboard because they are not as much in the country. I'm sure Dr. Gbemi will be telling us the figure later. So we assist, we support the pediatricians. Things like malaria, we don't want them to go and be disturbing our pediatrician. A child is stooling, we don't want them to go and be disturbing them. A child is having cough and catarrh. Those ones can easily be managed at the primary health care. That's the first level of contact. We manage them well. We also go for updates together. We learn even from the pediatrician about the updates, things like ORS, zinc supplementation, those new things that came, we learn it from the pediatrician, and we also make use of them in the community. I tell you, at the primary healthcare level, the pediatrician are actually short. If I tell you in the primary healthcare in Lagos, they are under the local government. We don't actually have pediatrician, manning any one of them. Most of them are the secondary care, that's the general hospitals, and in the private hospitals and in the tertiary care. So at that primary care, we are there, to fill in the gaps. And the ones that we cannot handle, like Dr. Gbemi have said, we send them to them so that they can have the proper care. They can have the proper care that they need to have. So like I said earlier, from cradle, we are there through the adolescent age, through their adulthood, and to the time they are about going to the grave, we are there to give the support. We also have a part, we are there to give the support, to the pediatrician, so that in this 21st century, our children, will continue to do well. They will continue to do well at the community level. We don't want to be hearing cases like tetanus because the pediatricians may not be there, but we are there to prevent such things like tetanus, diphtheria, tuberculosis, and the rest. We are there to help the children, to the state that, they be able to survive the under 5 mortality period. That period we are actually involved through this child survivor strategy. Things like family planning, we are also involved. It is said that when the mothers, when they space their children, they'll be able to nurse them well. The children will be able to get the best from them. They'll be able to have the best of education. They'll be able to have the best of development. They'll be able to have the best of everything. So we encourage them in family planning. We are extensively involved. There is hardly any family physician that is not a family planning provider. So that's those are the things that we do to support, child care in this 21st century. So these are the things that we do. We are extensively involved in education. We are also involved in research. We provide some of the data for our pediatricians, to use from some of the things that we see at the community level. But I hope that one day we have enough pediatricians so that at least a pediatrician will also be attached to a community, to a local government. Thank you. Thank you for listening.
Thank you so much, Dr. Rotimi. That's an amazing presentation of what you do, and we really appreciate our family physician. So for those who don't know, your family physician, I think I need to mute some mics. I'm echoing myself. Sorry, just a minute. So for those who don't know, the family physician is a your first doctor, everybody's doctor. Everybody should have your family physician that you can go to, and then your family physician can now refer you to any of these other specialists that are on this platform, including the gynecologists, including the dentists, and all that. So thank you so much. So if you don't have a family physician, you should aim to have one right now. Okay, I just want to know whether Dr. Jumoke is ready to give us our talk. Dr. Jumoke, are you ready? Okay, I can't see you. I can't hear you. Okay, can you unmute? I can see you now, but I can't hear you. Yes, okay. Can you unmute? Okay, I think yes. So because of time, I don't want us to waste our time, so I'm just going to go to our nurse. So usually, the doctors always work with nurses. We're a complete team, and and there are different level of nursing. Today we have with us a pediatric nurse. Some of you think all nurses are the same, but they're just like you have doctors specializing in different areas, and you also have nurses also specializing in different areas. So we have with us today Sandra Ibeh, who is a pediatric nurse. She's a registered pediatric nurse, currently working with the Lagos State Government Health Services at Maternal and Child Center, Muwa Dafin. She trained at School of Nursing, Holy Rose Hospital in Imo State, and then also went to the School of Post-Basic Pediatric Nursing in Ilorin in Kwara State. She loves to care for children. Like she said earlier, she's also one of our active pediatricians volunteers. So we're so happy to have Sandra with us today. So Sandra, please tell us, what does a pediatric nurse do when it comes to caring for the children? Please unmute yourself. Oh, yes, good. Thank you. Go.
Thank you very much. Once again, happy celebration to Ask the Pediatricians on their 6th anniversary. So I've been introduced already, so I'll just go straight to what I have. A pediatric nurse is one who has been trained to take care of children from birth to about 18 years. Some school of thought will say 14 years. So as a pediatric nurse, you have to undergo skillful training because children are unique in their own way. We don't have to treat children as adults or young adults. They are specific and they have specific needs attached to them. Not all children are the same. So as a pediatric nurse, we have to know different characteristics that are attached to children. So the roles of a pediatric nurse in this 21st century, when it comes to the holistic care of a child, holistic care is everything encompassing in the child. And in holistic care, we have to take care of everything about the child, including the family. Because if there is no mother and there is no father, the child won't be brought into the world or to us to take care of. So the very first role of a pediatric nurse is health education. It is very, very, very important that our mothers are health educated on what to do to take care of their children. It is also very important to educate parents, not only the mothers, if I should say, but we first deal with the mothers because they are the ones that are very close to the children, especially in the hospital setting. We see more of mothers than the fathers. So we have to health educate them on what their children needs. Health education encompasses on immunization, child nutrition, the growth and development of the child. I hope I'm not using too big grammars. The
No.
growth and development of the child, the preventive measures to take to ensure that their children don't fall sick easily, the promotive measures to take to ensure that children grow as they need to, and then the protective methods to use. Also, in health education for children that are given to mothers, we also have to health educate them. We also include family planning in our health education, because if parents have too many children, they won't be able to cater for the needs of anyone that comes out with a specific need. Another role of a pediatric nurse is child advocacy. We are, as the nurses, we are mostly in the hospital setting. We are more closer to the children than the doctors or any other health professional. So we advocate for the child by standing as a gap between the child, the parents, and then other health team in the health setting. We first, for example, in the workplace, we are the first people that the doctors ask, how is this child? We tell the child what we have seen. We tell the doctors or any other health professional what we have seen so far in the child, to see if the child needs more care, if we need to invite any other specialist, especially for probably a child that is born with a congenital abnormality, say for example with the heart. Most times we advocate for the child to see a pediatric cardiologist, or we advocate for the child to see a pediatric orthopedic. Also, and then if we feel that medications for the child is not being effective, we also advocate in such area. And then when it comes to the parents side of it, if for example a mother has been in the hospital so long because the child has been admitted for so long, and the mother is stressed up, because definitely there are so many problems that comes with hospitalization, especially when it comes with the parents. So we also advocate for either the father to come stay with the child in the hospital, or any other relative, so that there won't be too much breakdown, because I believe psychologically this helps in the welfare of the child, and to also enhance easy and quick discharge. And then we also advocate for in the religious aspects. We are not all about medically. Sometimes we involve spiritual aspects too. If you need to pray up for your child or something, it's allowed. So we, as a pediatric nurse, we advocate for such too. Also, family-centered care. Coming to family-centered care, it encompasses the whole children, the whole family, rather, the mother, the father, and other siblings. If a child is in the hospital for so long, there is this stress of hospitalization on the child. Sometimes that's why in most hospitals we allow for visitation of family members. So that will help also in care of the child for quick recovery and easy discharge and any other need that the child needs. Also, we have nurse communicator. It's almost the same thing as a child advocate. Children don't speak for themselves. We are the ears, we are the eyes of the children. Most times, for example, what I've observed of recent where I work is that when babies are hungry for food and they cry a lot for food, sometimes when I go close to them trying to prepare, because most times you health educate the mothers on the need for exclusive breastfeeding. Some of them will tell you they don't know how to express their milk. They find it difficult to do that. They want to go for formula and all that. But I see that when you come close to the child and you're trying to prepare food for the child keeps quiet. It's a way of communicating. The child has, and then I also encourage mothers, especially the preterm babies, most times to do kangaroo mother care and talk to their child. That's a way of communicating with the child, because babies hear, children hear. So if you do that, it will also enhance quick bonding, and it also shows care for that child. And there are also other roles of a pediatric nurse, but very importantly, we lay more emphasis on the need for health education and family-centered care, because our children these days, we need them. Children are blessed beings, and we need them to be healthy for us to take care of us. So we try as much as possible to health educate our parents, our mothers, family members on the need to look out for those children. And then if they have any misunderstanding or any complaint, it's best to speak to either your nurse who is registered and not any kind of nursery to say, or you go to the hospital to report your complaints. Most parents would want to go to their neighbor. It worked for my neighbor's child. It will also work for my child. I always tell parents, don't compare your child with other children. Your child is different from others. That it worked for baby A does not mean it will work for baby B. So it is very important that we all ensure that we look carefully into our children, pick out those specific needs, those specific care that they need. We ensure we find that out and make sure that we report to the hospital when need be. There are also other roles of a pediatric nurse. As a pediatric nurse, we research. We are also nurse researchers. We find out more, we research on care, different kinds of care, especially trending cares that are needed in the care of our children, while trying to abolish the old methods that have been used by our parents. We are scientific nurses too, because we work according to whatever care we give. We always have a scientific role to back it up. So I believe so far, as parents and viewers and listeners, we will try as much as possible to ensure that we obey and take to heart all the talks and health advices that our doctors and health workers give to us, to ensure that we take care of our children holistically. Thank you.
Thank you so much, Sandra. That's a beautiful presentation by our pediatric nurse. So we've heard from the pediatrician, from the family physician, we've heard from pediatric nurse. Dr. Olajumoke, are you happy to talk to us now? That's our gynecologist obstetrician. She should have started, but we have some ICE cups, so I hope we can go on now.
Okay.
Oh, lovely. Good.
Can you hear me?
Yes, we can.
Can you hear me?
Yes, we can.
Okay, thank you, because I've been moving around looking for the perfect spot. Okay, so good evening, everybody. Good evening, everybody, and happy anniversary to all of us. Thank you again, Dr. Gbemisola, for the good work you are doing, helping the Nigerian child. Let me straight before network humbles me again. Obstetrician and gynecologist in the care of the child. We're looking at the holistic approach. Now, you know that the pediatrician takes care of the physical child. The gynecologist takes care of the unseen child. All right, the child that you cannot see, but the mother. And the gynecologist is also the doctor that takes care of the mother. Now, the mother has a very vital role in the care of the child. That is, the mother of decision, prepare a very delicious meal, and then you put it in a plate that has been used for over 2 months, that has molds inside, all sorts of things. No matter how tasty and attractive the food is, once you pour it in that terrible full of moss, and it changes the food. Can you all hear me? Can you hear me? Hello, can you hear me?
Yes, we can hear you.
Hello, can you hear me?
We can hear you, Dr. Jumoke. Just go
Yes,
on.
we can.
We muted
Okay,
because
I
we don't.
believe you can hear me. Can you hear me?
Yes, yes, we can. We don't want to
So
interfere
it
with your
changes the taste of. Okay. Okay, so it changes the. All right, so it changes the taste of that food. So likewise, the mother plays a vital role in a healthy child. The result of having a healthy mother will give you a healthy child. And the obstetrician is there to ensure that we have a healthy mother and back to a healthy child. And actually, this care of the mother starts even before she gets pregnant. That is the ideal thing. Preconception, before she gets pregnant. Because a healthy mother will have a healthy mother at the end of the day. So first of all, starting, we take care of the woman before she ever gets pregnant, educating her about her lifestyle as a woman, telling her things she needs to know herself. For instance, if a woman wants to become a mother, it is the duty of the gynecologist to educate her that some lifestyles are not are not healthy. For instance, a woman that smokes, a woman that takes alcohol, a woman that abuses drugs, takes recreational drugs like cocaine, marijuana. Okay, this definitely will affect the baby and the physical baby at the end of pregnancy, and she'll have a healthy baby. Also, a woman may have medical conditions like that before she gets pregnant. Those diseases are under gynecologist to ensure that before she embarks on pregnancy, the journey of pregnancy, that these disease conditions are under control. The baby can affect the baby from having a very, very large baby. If her gestational diabetes, for instance, there are some things like having difficult labor because they are so big. All right, so
We're really struggling with Dr. Jumoke's presentation. I think she dropped off again. But I think we get the gist of Dr. Jumoke's presentation in the sense that the the gynecologist take care of the unseen child, while the pediatrician takes care of the one you can see. So the first 9 months of everybody's life is under the care of the gynecologist obstetrician, and they also take care of the mother. And I think she was stressing the importance of the mother's health before pregnancy, during pregnancy, and some lifestyles to avoid. So I will obviously hope Dr. Jumoke can say join us again, and then we can take the rest of our presentation. Because of our time, I think we just go to our pharmacist. So most of you know that I can't see Dr. Buki yet, so hopefully Dr. Buki too will join us, our dentist, to tell us about the teeth. So most of you know about drugs and the fact that most doctors, as part of our treating your babies, we always prescribe or recommend drugs. And so the person who can help you, okay, I don't know whether Dr. Jumoke is able to finish writing now, get ready. But let me just quickly check. Dr. Jumoke, are you able to complete your presentation? Sometimes network can be horrible. Okay, I think Dr. Chimaka, are you able to complete your presentation so that we don't have to break it into two?
Can you hear me?
Yes, we can hear you.
So we also want to ensure the obstetrician ensures that in pregnancy, everything is okay with the womb. That is the baby, they get every single. So or a scenario where whatever the mother affects the baby. For instance, if the dog she's smoking, doing all sorts of things, it will affect the baby. If the woman has medical conditions in pregnancy, it will affect the baby. So the job of the obstetrician is to make sure that if she has medical conditions, they are well controlled during the growth of the baby, so that in case you have complications setting in, you can intervene quickly. Also, the job to take care of the unseen baby. These days, things have even gone as early as possible in pregnancy. There are tests we can do that can be done to find out whether a baby has some congenital abnormalities. Between 18 to 22 weeks of pregnancy, we do what
Okay, I think we'll just let Dr. Jumoke send us a presentation later on. Okay, so Tinyan, can you unmute, and we're going to talk about pharmacists. What's the role of the pharmacist in the care of children? And so Tinyan is our pharmacist. She's a consultant clinical pharmacist. She's a graduate of pharmacy from the University of Lagos. She's also doing her MBA with National University, United States of America. She's also an entrepreneur, and she's the CEO of Cephalena Pharmacy in Victoria Highland, Lagos. So Tia, welcome, and please tell us what you do as the pharmacist in holistic care of children. Can you unmute yourself? Because I can't seem to be able to unmute you. Okay, good. You're unmuted now. You can go on.
Good evening, Dr. Boyede.
Good evening.
Good evening, Dr. Boyede. My fellow. Can you hear me, please?
Yes, we can hear you now. It was a little bit dragging before, but I think it's better now.
Hear me? Hello?
Hello, we can hear you. Just go on.
Hello, can you hear me?
Yes. Tinya, we can hear you.
Good evening, everyone. I'll
continue.
go straight to my presentation. Thank you, Dr. Boyede. Yeah, thank you. A pharmacist is a healthcare professional who is educated and licensed to deal with drugs and then the composition of drugs, properties of drugs, Yeah, all right. So pharmacists are responsible for dispensing drugs, monitoring drug interactions, drug-food interactions, counseling patients regarding the proper usage of their drugs. So a pharmacist's duty is that we want to ensure that the right drug is given at the right dose, especially to children, and the right formulation. Some drugs don't actually come in maybe the formulation required to give a child. So it's the duty of the pharmacist to specially compound that drug so that it will be available for the child's use. So when we are talking about holistic approach, we are talking about everything that has to do with the child. So we want to help them mentally, we want to help them physically, we want to help them emotionally. Or like maybe some people will say, are you sure this drug will be good for my child? Are you sure this drug will not affect my child? What are the side effects? It's the duty of the pharmacist to reassure the child that, reassure the mother of the child that if all drugs have side effects, if you have any harsh drug reaction, you should report back doctor. Just reassure the child, reassure the parents that everything will be okay if the drug is given properly. So our duty is also to ensure that if the patient cannot afford the drug, if the patient cannot afford the drug, we look for a generic, that's another brand of the same drug, so we can the patient. Some cannot afford some drugs. It's for us to look for another company that has the same ingredient and give to the patient. And if maybe that drug is not available at all, is the pharmacist's duty to report back to the doctor if maybe a substitute can be given to the patient, since that one is not available. So feedback from pharmacist to doctor, from doctor to pharmacist for the well-being of the patient. That's our duty. So we also ensure that the drugs should be stored properly. Storage is very important. Storage can ruin, that's why some people will say the drug did not work. Storage is one of the important ingredients of drugs. So we have to ensure that there is no gap, any failure in the process, that's from the doctor down to the patient's stomach. If we don't do our duty, if we don't store the drugs properly, if we don't make sure there's ambience in the environment, it could lead to treatment failure. So our duty is to ensure that safe and quality drugs are delivered to the patient. If some people are not in, some people don't have places where they can get quality drugs, like maybe where served in the north, and such situations, first, maybe in a general hospital, if you don't have the drug, you can tell the patient that, when you get it from this patent medicine shop, report back to me. That's what I used to do then. And I found out that, in fact, many of the drugs are not even related that they give them. So can give them, like someone gave for Gbemisola. So if you are in such environment, work in a general hospital, drugs, let them give you feedback. So we want to ensure that there is no bridge. There is no bridge in the treatment process. The person gets the right drug, the right dose, the right formulation, at the right temperature, so that everything for treatment failure. The pharmacist should also ensure that there is feedback, not just to doctors, like in cases where we have inpatients, like in the hospital, we should go around to ensure that patients are being given their drugs at the right time. Patients, children are being given the drugs. Go around, make sure that they dilute the drug properly. Sometimes the nurses, because they are different brands, they may not know how to dilute this particular brand. It's the duty of the pharmacist to go around, ensure that such drugs are being diluted properly, so that they are given to patients, given to the children. So the pharmacist's duty is to relate well with the health professional to ensure that patients get drugs at the right temperature and how they should be taken, not just giving 3 times a day haphazardly. It should be either 8 hourly. Let them know how many hours in between each of the drugs. If it's 6 hourly, you know it's supposed to be like this. If it's before meal, you should write before meal. If you should not take it with antacid, antacid should not be given at the same time. So all these things, like antacids, interact with drugs and reduces their efficacy. So it's the duty of the pharmacist to ensure that they communicate with health professionals, communicate with the mother, communicate with whoever is taking the drug, that these are the rules. These are the rules. I believe with this, errors will be reduced to the barest minimum if pharmacists do all what they are supposed to do. The prescription errors, look through the prescription, ensure that doctors are humans, to ensure that the prescription is written by those.
Okay, we seem to have a lot of issues with our professionals and the connection, but I think most of us have already gotten the bulk of Dr. Of Tinyan, our pharmacist presentation. She and Dr. Jumoke may end up completing their own part of it in the when we're taking the Q&A, the question and section. So I think I'll just go on to patients now, who is our speech and language pathologist. I found out for the therapists, many people don't even know they exist. Many people don't even know what they do. And so this is one of the things we want people to realize, that the care of our children is not just doctors and nurses. There are so many other health specialists that are very vital in care of our children, and one of them are the One of them is our speech and language therapist, and the others that you're still going to meet shortly. So I'm going to ask Patience, who is our speech and language therapist, pathologist. Okay, before you meet her, I just want to give her a little bit of a brief. My apologies, I'm always waiting. Okay, so Patience is our speech and language therapist. She's experienced and she's been volunteering for us since inception. She's passionate about helping children and adults find their voice. She graduated from the University of Ibadan, where she obtained her first degree and a master's degree in speech and language pathology. And she's currently running a PhD program. And she also has a private speech outfit, the Speechy Heaven, which is in Jos. So we are happy to have Patience with us this evening as she talks to us about the role of the speech therapist in the care of our children. You're welcome.
Thank you very much. Good evening, everyone. I prepared a slide because I received an official letter, so I was thinking everyone would present using a slide. I won't take much of our time. Thank you.
Yeah, if you want to share your slide, you can share it. Are you able to share it from your hand?
Yes.
Go ahead. Okay, Tinyan is back. So Tinyan, you will please complete when we're taking the Q&A because we're not so sure how soon you're going to come back. So that's why we have to move on to the next person. Thank you.
Okay, can we all view this slide?
Okay, don't worry. I don't think they can view it, but I will hide it. So you can make only your screen, the particular presentation itself, so you need to select the particular screen that you want us to see because right now we're seeing the whole of your computer.
Okay. Sorry, let me stop sharing.
Yeah. Or you can just talk to us and we can later share your slide. So if you send it to me, I can share it for you.
Okay. So, okay. Hello, everyone.
Yeah, we can see it now.
It's good to be here.
Okay, I just saw your slide now, but you have gone back to your full computer.
Okay. I thought I stopped sharing already.
I added you, yeah. Don't worry. Just go ahead.
Okay. Good evening, everyone. Thank you for having me. So I'll just run through what we do with the kids when they come see us. So the first thing we do is assessment. We assess the child to see if the child really needs the service of a speech therapist or not. And also during the assessment, we try to see, okay, what is causing this speech defects? Why is this child experiencing this issue? We diagnose to know what exactly what exactly it is that is causing the defect. We also do some other assessments. We are trained to carry out some standardized tests to figure out some of the neurodevelopmental disorders, such as autism, that usually causes speech disorders. Then after assessment, we plan the treatment. We put together a treatment plan. It's usually individualized. We put it together to help the child. So when we put the individualized speech treatment plan together for a child, the child would usually come sometimes 3 times weekly, 2 times weekly, depending on the case we are treating. So would carry out speech therapy on that child. Then also, aside working on the treatment plan, we actually review from time to time to see, okay, are we making progress? Is this child improving? Has this child improved in a particular aspect? So if the child has improved in that aspect, we take out that item from the child's treatment plan, and then we move on to other items which needs treatment. Then also we do referrals. For instance, in some cases we are part of a team. Like in cases of cleft palate, we don't just work alone, we work with other professionals like the doctors, the myofascial people and all that. So we write reports, we keep records, and we let the other professionals know our view as to what is going on with the child. So also we do counseling. We counsel the parents. We counsel the parents as to how to go about what the child is experiencing. Is if parents want fast progress with their child's speech and language, they shouldn't just rely on the 90 minutes a week or maybe 3 times a week session the child goes for speech. They should also do a follow-up at home. If the child has a nanny, we help to counsel the nanny. We talk to all the persons the child has contact with. Sometimes we reach out to the teachers to let them know, okay, when you are trying to pass across information to this child, don't just give the instruction this way. How about you try this method? You will get feedback better using this method or that method. So we reach out to other professionals. We reach out to the physio sometimes, depending on the case we are working. We reach out to physios, occupational therapists, and other professionals working with the child. Then also, we work on the child's, sometimes it's not just speech, because speech is what a child says. Sometimes it's language the child is having issues with, understanding what people tells him or her. So we find out what exactly the problem is and we address it. We help the child understand pragmatics, like how loud should I speak when I'm speaking to people? How should I react, or what should my body language look like when someone greets me? Should I just frown or should I smile? Should I stretch when someone stretches their hand to shake me? Should I stretch mine or I should just stand and watch? Okay, so that's pragmatics. We teach them how to respond, how to carry out social activities, how to be social human beings. We also work in conversational skills. Is it parallel conversation? Is it self conversation? Any kind of conversation. We teach conversational skills to children. Then also we help parents check their kids' developmental milestone to see if everything is intact. Because sometimes when people come, they tell us, oh, my child is not speaking, my child does not carry out instruction whenever I tell him or her to do something. Sometimes it's not only the speech or language that is the issue. Sometimes the child is also having some other medical conditions. So we look, when we look at the checklist, we'll be able to tell if the child needs referral and what kind of referral the child needs. So these are some of the things we do in order not to take much of our time. I'll be answering your questions as they come in. I'll take note of them as they come in. And I'll also post the slide in the group. I'll post it so that we can access them later. Thank you.
Yeah, thank you so much, Patience, thank you so much. We appreciate that presentation. So I guess most of you now know who a speech therapist is and what they do. I would have loved to go on to our occupational therapists and the physiotherapists, but they appear to have dropped out. Hopefully they will come back because what's his name? Okay, Samson is back now. Okay, but let's just go on to Temi. Temi is a behavior therapist. I'm sure this is also something many people are not familiar with.
I'm
Because
back.
who is back? Is that Rotimi? Is that Samson? Okay, all right, no worries. Okay, you can unmute yourself. Okay, sorry, Temi, just give me 1 minute. Let's take Samson's presentation. Hopefully, it won't drop out again. Samson, you need to unmute yourself because we need to hear you talk. Good. So,
Yeah,
because we
thank
want
you.
to take therapies in succession, so it's easier to get them. So, you've got 10 minutes just to tell us what occupational therapies do, how you work with children. Thank you. So, go ahead.
All right. Well, basically, I need to congratulate our pediatrician for this, anniversary. It's not easy, 6 years. And basically, occupational therapy. What is occupational therapy? Is an art and science of directing man's participation into activity that is medically prescribed by a professional to aid recovery. So, who is OT? OT is a trained person that carry out, engage patients in activity, which will aid their recovery. So, how do we get the patient we treat? We basically, can you hear me? We basically get our patient from different referrals from doctors, speech therapists, physical therapists, nurses, and other professionals and all that. So, what I'm going to be going through today is OT process, which is the way occupational therapy work. So, which is we screen our patient like any child that comes around, like we need to screen them for, because there is a problem that we always have in our clinic is there are some misdiagnoses and what I call mixed diagnosis, so that they don't know, okay, which one is Rett syndrome, which one is autism, which one is mixture, because there are some of these kids that come with what we call comorbidity. They have different, challenges together. So we review all these cases so that we'll be able to know the type of activity we are going to be giving them based on the area of the brain this condition affects. So we have to, evaluate the patient. So in evaluation, occupational therapy has to, because we have different scales we use to know what is the main problem of this child. If the child is having problem with dressing, with fixing, arranging, organizing, and all cognitive challenges, and some of them has poor motor skills, they have fine motor skills, they have adaptive skills, which include like dressing, grooming themselves from 0 to 18, and which may be due to underlying disease conditions. So we evaluate so that we'll be able to rule out, okay, what are the problems that cause all these things, and we have to understand the parent from the environment, from religion point of view, and their belief system and all that, so that we're able to know what we can come in to treat the child appropriately. So occupational therapy do a lot of observation of the child. When you see a child, like for example, I've been to church because I know that is where most of these kids, parents always rush to, because they want to, they believe it's a spiritual problem. So when I spot a child with, so then I will be able to, okay, liaise with them, because occupational therapist has a duty of going to grassroots to understand what are the problems they are facing. So, and I find out in Nigeria that most people go to church to seek for, spiritual intervention for all these challenges. So I've been able to go to a church to do my visual assessment of my kids that have special needs. And because of the knowledge of research, I was able to do that anyway. So when they come, we do assessment, which we are going to see the performance ability of the child, whether cognitive, sensory, and all those things. So we have to assess what are the apparatus affecting this child performance. So if we are able to rule out all these facts, then we'll be able to give our intervention. So occupational therapy intervention is basically into three parts. We have preventive intervention. For example, we can give splints for a child that has cerebral palsy, for example, in order to prevent contracture of the joints, in order to prevent stiffness or joint decrease in function. So depending on the tone of the muscle. So occupational therapy can also give secondary intervention, which for example, we have to decrease the incidence of what has occurred. For a child that has autism, for example, we need to prevent the deterioration of that condition. We have to salvage the brain function. The child needs to be engaged, because most of the time parents like to keep them indoor. They don't want to let them come in. So by so doing, the child will be vulnerable to have mental, I don't want to use, the child will have intellectual deficits because of keeping them for long. Because when you don't use the cognitive apparatus, you are going to lose it. So we encourage them to bring them out, not to keep them indoor, so as not to give us more tasks to do. Because when they bring them out eventually, we now find out that, oh, they are now looking for magic. What they will have started when the child is 3 years old. Before the child is 3 years old, they should have bring the child to occupational therapy to give intervention to. So occupational therapists do early detection also, so as to prevent future deterioration. And the tertiary, which they always bring to us, is a child that is already 25 years old, and they have not been given appropriate intervention. So occupational therapists can also still come in that area. So that's when occupational therapists will give them vocational activity, which they will engage in, so as to keep them engaged, involving them in skills acquisition, program. So those are the different rules of occupational therapy in every age, based on the occupational therapist assessment. I have to rush through all these things because of our time, and so that we'll be able to take questions. So occupational therapy will plan intervention. So OT need what we call clinical reasoning. And how do we get clinical reasoning? Is by liaising with all professional bodies like this. We brainstorm. Okay, what are the areas of challenges? You see when you do your own assessment. And you, speech therapists, nurses, what are your reports? So I like to employ all our team and colleagues that are listening. They should try and document everything they are doing with the child. They should document it so that we will be able to, keep other people informed on the progress of the child, because that is that aspect actually, so that we'll be able, it will help occupational therapy to plan intervention, because we have to relate with the child from treatment planning point of view. So we do discharge planning as well, so that some of my kids, I discharge them to school, which I need to put a trained therapist in the school to shadow the child, how the child is engaging in school. Because most of these kids, we just leave them in school so that they will. So I train some of these therapists so as to. They are not therapists actually. They are facilitators. So they are the ones shadowing the child, make sure the child is engaging in classes and all that, especially autistic and child with intellectual disabilities. So I follow up virtually now. COVID has made everything virtual now. So I do follow up. I interview parents. I get a lot of feedback from parents, and I try as much as possible to put up some books so that parents can read, so that it will be like a resource for them as a OT. That is our scope of practice, so that I will not take much time, so that I can just finish my presentation. So question can come so that it will make me to reason and analyze the answer. Thank you. Happy anniversary.
Thank you, Mr. Dorojai. That was a beautiful presentation. Without much ado, we want to quickly go to our behavior therapist, Ms. Temia Shoba. So please, can you tell us what is your role in the holistic care of children? Thank you. Temi, I think you are muted. Where's your mic? Where's Temi? Yeah, you're not muted, but we can't hear you. Okay, so maybe you have to give your balance. Temi, can you talk? We can't hear you. Temi, can you hear me? Okay, I can't hear Temi. Temi, can you hear us? Can you type something in the chat that we know you can hear us? We're also trying to get Dr. Buki, and the physiotherapists are really struggling to join us. I guess it's the network has been so horrible for them. So apologies about that. We couldn't get the physiotherapists and the dentists, but I think who is here now? Is that Temi?
I'm here.
Who are you? Is that Dr. Jumoke?
Dr. Jumoke is here.
I know you are there. I've seen you,
Dr.
Dr. Jumoke.
Jumoke is here.
I know you are here. I'm waiting for Temi to. Temi is having a platform now, but I can't hear her. Temi, can you talk? Let's know whether. Can you hear me? You can hear me, obviously, but I can't hear you. I don't know what happened to your mic. Can you go out and come in again? Maybe
She can hear you.
Yeah, just go out and come back again and see whether it will work. Okay, so Dr. Jumoke, it seems you have a strong connection now. Can you quickly round off in another 2 minutes, your presentation? Hopefully we get to now. Oh, she's gone again. Dr. Jumoke has disappeared. All right. Okay, so we'll start taking question and answer now because all the people that are presented are here. Yeah, Temi can hear us, but we can't hear Temi. Temi, you need to go out and come back in. Remove yourself and come back in again. So that way you may correct whatever is delaying your mic from talking.
What do you always want to have the purple?
All right, so I'll start taking question and answer now because of time. I apologize on behalf of all the professionals that couldn't do the presentation or those who have lots of hiccups. I guess it has to do with Nigerian network. Some of our mobile networks are really wonderful. Let's not say something else. So all the questions for the panelists, please drop your questions on the comment section. We're going to start taking the comments now. And any of the other professionals, if they come online, then we'll allow them to undo their part. So the people that we couldn't get today is Dr. Buki. She's made efforts. She joined us severally, but she keeps dropping out. She's a dentist. She's a pediatric dentist. And it's straightforward, like the pediatric dentist take care of our teeth, of the children's teeth. But many of us are used to the dentist, but we also have the pediatric dentist as against just the general dentist. So when it comes to the teeth of your children, the pediatric dentists are the ones to go to. And just like when I was talking for pediatricians, the pediatric dentists want you to come even before your children's teeth has issues. Some of us think your children's teeth, it's only when they have issues or holes or decay or dental caries that you should come, but the dentist actually want you to come from the age of 1 year and they want you to come regularly. That's the job of the pediatric dentist. And of course, the physiotherapists, they do take care of physical. Most of us are a bit familiar with physiotherapy. Unfortunately, Shola couldn't join us today. She's been trying to join us, but she's having connection issues as well. So they take care of anything physical. So children are not walking, children are not able to run, they are not balancing. So those are the job of the physiotherapist. And so it's not only when people have pain or back pain like you see for adults. So the physiotherapists do a lot of work with children who have issues with their what we call gross motor or mobility issues. So thank you so much. So just tell us your question and who you want your question to be directed to. Facebook users, we can't see your name. So because you didn't give StreamYard permission to show your name, so it is better you put all your questions in one comment so that it makes sense to us. So thank you so much for those who are just joining us. This is the health panel, and this is we've got about 10 professionals talking about their roles in the health of our children. We've got Dr. Jumoke. Dr. Jumoke, are you stable now to complete your presentation while people are giving questions and answers?
Well, I will try. Can you hear me?
Yes, I can hear you. The last time I was supposed to introduce you,
I will try. I'm very humble now. I will try.
Go on.
Again. Okay, I can hear you. I can quickly complete though. All right, so I was saying that in labor, the obstetrician also plays a vital role because you know that the mother still supplies all the child's nutrients, and if there is any cutoff of that supply, that can actually affect the baby. All right, so the obstetrician is there to ensure that all the baby is still doing well whilst in labor, withstanding all the stress of labor, and also to find out that if the obstetrician is also there to identify if there is any stressful condition in the baby that may compromise the baby. For instance, if labor is too prolonged, very nice outcome, and that is why you have some having what we call bags. It's just because they have not had enough of oxygen and it has actually affected their vital organs. And you have children with cerebral palsy, and this can actually happen as a result of the events that occurred in labor. So the obstetrician is actually there to ensure that labor goes well. And if for any reason she thinks the baby is not compromised, she can experience or sometimes instruments to bring out the baby as soon as we can, so that the baby is not compromised. So the job of obstetrician is also to ensure that even post delivery, the mother remains healthy. Remember that it is the healthy mother that can take care of the baby. After delivery, of course, the baby still derives nutrients from the mother. The best food for the baby is the mother that can give, and that is breast milk. So you know that it's only a healthy woman that can breastfeed a baby to the for the required period. And so you want the woman to be very, very healthy at that time. So of course, that's why we have follow-up care. It's not just you deliver and then that is all disappear. You have the postpartum visits, or we call it postnatal visits, and the frequency of that visit depends on the type of delivery you had. And if the doctor feels that you've had some issues, they want to still care, the visits may be more. But at the end of the day, it is to ensure that, we can identify people that have postpartum depression. Some people are so depressed or they have psychosis that they may harm the baby. Okay, and that can lead to a sick baby. So you see, when we talk about the obstetrician, is actually a broad spectrum job, starting from the time the woman, before the woman gets pregnant, ever before the woman gets pregnant, because a healthy mother definitely, as the container, as the conveyor of the baby, will give birth to a healthy baby. One unhealthy mother, a sick mother, a challenged mother, most likely will not have a healthy pregnancy. And if the pregnancy is not bedrock, so a sick child will probably, a sick baby will probably translate to a sick child, depending on how long the sickness has become. So thank you very much. Finally, I've been able to round up. So I hand it over to you. So for mothers, the take home is that everybody is important. Every specialty is important in ensuring that a baby is healthy. Okay, so the antenatal care is not for fun. It is a serious thing. Your lifestyle is not for fun. If you are going to be a mother to be, or you have not completed your lifestyle, your eating habits, they are not just for fun. It will affect your baby if care is not taken. So you have to do everything to ensure that you have a healthy pregnancy and a healthy baby. Let me stop there. Thank you
Wow,
very much.
that's amazing. Finally, we got to hear Dr. Jumoke smoothly and there was no break. So if you have questions for Dr. Jumoke, please pop it in now before she would disappear. Okay, Tammy, can you talk? Can you speak now? Tammy, we can hear you still. You you using your laptop or your phone? So if you are using your laptop, try use your phone and see whether it will work. Because I think it has to do with your mic. Something is wrong with your mic because I could see you and your network is very steady. So I guess it's your mic. Check your mic setting and able to put something. Anyway, I will start talking for you a bit. So behavior therapists take care of our children who has got behavior needs and like children with autism and all that. So Temi is here herself. So hopefully we can get your mic sorted and then we can hear you speak because we can definitely see you, but we can hear you. Please check your mic. Make sure your mic, your device mic, your device volume, check that it's at 100, and if it's not, muted. I guess that's why because your mic on the StreamYard is on, so that means it's the mic on your device. So you can try another device, either your phone or try a laptop. Let's see whether it's that. All right, so it's time to take question and answer. I really want to appreciate um, all my professionals for staying here. It's almost 2 hours. I know, because and battling with technology, mobile network in Nigeria can be very wonderful. So I appreciate everybody who has stayed on. So we're going to start taking question and answer now. So I will tell you whether the question is for you or for somebody else. I'm trying to see whether we have any questions. So most of the initial stuff are compliments, but I've seen a couple of questions. Okay, somebody is saying kangaroo mother care. What does that mean? I think that is for eBay, Sandra. Kangaroo mother care, what does it mean? Do you want to unmute? Everybody can unmute now and just answer whenever you want to answer.
Kangaroo mother care is a type of how do I put it? It's a type of care for babies and their mothers. It involves skin to skin contact. It can also be called skin to skin. In this process, the baby is mostly used for premature babies. So the baby is left bare with only the diapers, and the mother doesn't wear a bra, so that the baby is inside, and then the baby is held tightly to the mother. And it will also be positioned in a way that the mother can view the baby's face. The baby would hear the mother's heartbeat, and they can talk. So it's a kind of contact. It's more like outside the incubator. It's also, to provide warmth and to enhance bonding, to prevent infection. It's a type of care that is being done for babies to enhance bonding with the parents. It can be done either with the mother or with the father. I hope that explains it.
Yes, I believe it does. So, have you seen a kangaroo before? Okay, you can go just check and look at how kangaroos carry their baby. They carry their baby in a pouch, and they are that's exactly what you do when you are doing kangaroo mother care. So we learned it from the kangaroos. It's a way of keeping the new preterm babies warm. Thanks, Nurse Ibeh. I'm just scanning for the questions. So yeah, I don't want to just be posting all the thank you. Yeah, okay, yeah. Somebody say my baby came out so big. What can one do to avoid having big babies? I think that is for Dr. Jumoke. What can one do to avoid having big babies? Dr. Jumoke, are you still with us? I should disappear. No, you should see her. Your meats.
Yes, I'm here. Okay, so we'll start with your weight. Okay, so yes, can you hear me?
Yes, we can hear you.
Can you hear me?
Yes, we can hear you.
Can you hear me?
Yes,
can you hear me?
Hear you.
So an elephant cannot give. Okay, so an elephant cannot give birth to a.
Oh, she's disappeared. Okay, so Dr. Chimaka will come back to answer that question, but she's going to try to tell you having big babies also has to do with with you as a mother, starting with you. But I will just wait for Dr. Chimaka to come back and finish her answer. So, yes, please, Loretta, you can ask your question. We're going to answer it now. Somebody said I can hear Tinyan, but I'm sure they can hear her now. Okay, I think Tinyan is back. Yeah. Yeah. Why don't they carry out speech and sight tests for kids at birth in Nigerian hospital like they do in other developed countries? I guess that question should be for me, I guess. As I'm the pediatrician, or is it for patients? Okay, yeah, it's for patients. Go ahead.
Okay, like you said, like they do in developed country, where we are still developing in Nigeria. And as soon as we have enough hands, as soon as we have enough speech therapists, we'll be able to do that. But for now, the numbers of therapists we have in the nation can't cover for that. Thank you.
Yeah, but I'm really curious. What do you mean by speech and sight test? We don't do speech and sight test, but we don't do anything like that. We do hearing tests. If it is that what you mean by neonatal hearing screening, because this is a video that's been watched all over the world, so we really need to be careful what we say. So you really need to be careful. Nobody does speech test. Baby don't have speech at birth. What we check for them is their hearing, and that can be done. Newborn hearing screen is done in most countries of the world, but not yet in Nigeria. And for sight tests, we also don't do sight tests at birth in any country of the world. But the doctors can check that your baby's eyes we examine the baby basically, but we don't do any particular sight tests at birth as well. So I know you are asking some questions, but maybe you're not using the right terminology. So because the way your question is structured is actually not correct. Nobody does that in any country of the world. So you may want to re-ask the question again, so we know what text you meant, and at birth, because at birth is also very key in your question. So those tests are not done at birth anywhere in the world, and so I really want to be careful. We are actually answering the question you meant, but I know there are some tests that are done at birth, basically in the hearing screen, that we don't do in Nigeria. Okay, so this is also for patients, so don't run. A child has stammer. Can we say that the child is having difficulty with speech, and can it be corrected through therapy?
Yes, stuttering can be corrected through therapy. And before we recommend speech therapy for a stuttering child, we want to know if the child has relatives who stutter. That's when we'll know if it is really an issue. Also, the age of the stuttering child. Is the child less than 3, or is the child up to or above 5 years old? So if the child is above 3, or the stuttering has been for over or up to 6 months, the child has been stuttering consistently for like 6 months, we recommend speech therapy then. Um, Dr. Boyede, I think you are mute.
Thank you for letting me know I'm muted. I was trying to avoid a lot of background noise. Yeah, so I think Sandra was saying something about whether the other question about hearing, about sight and speech test meant in utero, but I don't think so. We don't do any of those tests in utero. The Facebook users say in Nigeria the cost of therapy is expensive, and the children who need this service to now afford them. What can we do? So I think this is for patients, for Samson, and for Shola, who is trying to connect, but our devices is not connected. I don't know why, which is very sad. Okay, so I think let's start with Samson. What do you recommend? And the patients can also talk to that as well.
Yeah, it's a very nice question actually, which I wouldn't deny the fact that I know I can feel parents' pain when they are, appealing, begging therapies, and so that is when therapies, compassion, and what OT we call therapeutic self will come in. So definitely you can always see occupational therapists that are trained in Federal School of Occupational Therapists. You can go there and they will definitely give you, cheap ones that you can afford. And you go to, different hospitals, federal hospitals, they have occupational therapy there, and I think it's not expensive from there. So if you go through government, so if you are looking for private therapy all over the world, it's expensive. So I mean, you cut your coat according to your coat actually. So that is the way I'm going to put it. If that answer your question. Even me, I'm expensive. I will not tell you I'm cheap.
Okay, I believe it does. Patience, do you want to respond to that as well?
Okay, so expensive or cheap is relative depending on who is speaking. So we need organizations, we need government, we need different bodies to invest in health. An organization can come up and say, okay, I want to sponsor a child with speech needs to have, who cannot afford speech therapy, to have this service. You understand? And if there are bodies who can take these responsibilities, and if the government can create more health jobs, I believe this won't be so. But as long as majority of these professionals are practicing privately, the affordability won't be realistic. Thank you.
All right, thank you so much. Temi, can you speak now? Because the person said the question is for you as well. But I guess your answer is going to be similar to Patience and Samson as well. But I can answer that question as well as a pediatrician generally, because when we talk about health, health is expensive all over the world, and this has nothing to do with therapists only. Everybody, health is costly. Somebody's got to pay for it, and most countries rely on what they call health insurance. So you are paying, everybody is paying a token, and then the government now share it to those who need it. Some people will pay and don't need it. Some people, and in some countries where they don't have health insurance, the government, like in the NHS, the government takes care of the health bills for the, of course, they also take taxes from the people. So invariably, somebody is paying for it. Health is always expensive. But if we say health is expensive, then if you want to try the alternative, which is disease or not going, then it's going to be, that is even worse. So that is about that. So the issue is that we in the number one, in Nigeria, we see so many children. So definitely that will push up the price. And because of that, the government needs to be the one taking care of some of the people that cannot pay. Even if you make it 10 naira or 1 naira. But even the immunization that is free, some people still don't go for it. So that is that. So if you have a child who has special needs, that is why tomorrow we're going to be talking to people like Felicia, who is working with Super Parents Foundation, trying to support parents. But health is need. I can tell you how many times people will come to ATP clinics and they want to speak to a pediatrician. And when we tell them the fees, which is one of the cheapest fee ever, they will just go away, and that's the end of the conversation because it's expensive. Training health professionals is expensive, and they also have got bills to pay. And this is one of the things that ATP is also trying to do by making sure we help you take care of the prevention aspect, give you general information, things you can do. But when it comes to now seeing the specialists or the professionals, I'm afraid we got to pay for it. So this is where we need to now take the government responsible, and like, you got to provide these services for us. I don't know how many speech therapists we have in the whole of Nigeria. I'm sure they are not enough. The same thing with occupational therapists, the same thing with behavioral therapists. And also we also have some people who are not even professional. They are not even people that have gone to university, like Samson and Patience here. Some of them just, they are what we call technicians, but because there is no professional, so they just also are ripping off people, and they're not even providing quality service, which is one of the things that is a very painful aspect of it. So you really need to be careful who you see. Ask them for their qualification. Ask to see. So if you are going to pay so much, you need to be sure you are even paying for somebody who is giving you the appropriate services. So, and like Samson said, government hospitals have this professional, not so many, but at least you can still get a token, but you have to now become your assistant therapist. So that whatever they show you, they say just draw the hand like this. And when you go home, like patients were saying the other time, that the 90 minutes they will spend with your child is not going to be enough. But the remaining 24 hours, the child is with you. So you have to do the rest of it. So these are the things we can do for now. But the therapists are not going to reduce their fees because they also have got to pay. And to be honest, sometimes Nigerians don't want to pay for health. We take health for granted. Most of you would do makeup. And this, you will do it for 2 hours, you pay, I don't know how much you guys pay, maybe 50,000, 100,000. But if a therapist asks you to pay the same for an hour of therapy, I don't think any therapist charge that much for an hour of therapy. But people will not take it serious. They will like, that's too much. But they pay that much to tie gele or to do makeup or to do burial ceremony. This is how unserious we are in Nigeria. We don't take our health as serious. We rather take burial ceremony. We would rather take all those things more seriously and waste our money on them. No apologies for saying that, because we need to start realizing that health is wealth. We need to value our health and we need to pay for it. It's never going to be cheap. It's either we pay or the government pay. Somebody must pay for health. But as long as we think we're just going to be getting everything for free, and we're not taking it serious, we're not going to get it. That is the truth. So all the federal government responsible, all your state government responsible, all the local government responsible, all yourself responsible. But somebody's got to pay. And some of us can go for there are private insurance now where you pay a certain token every month, and they can take speech therapy and occupational therapy as part of the benefits that you're going to get. So those are the ways by which we can do this. But to say we're not going to pay anything at all, is out of the question. Unfortunately, for parents who have children with special needs, most of this burden falls on the parents. And it's very sad because you are also taking care of the child. Some of you are even out of job because you have to take care of these children. So somebody must stand up. So tomorrow we're going to talk about other aspects of health. Today we're just focusing on the health professional, but tomorrow we're going to talk about all the professionals that have to be part of this conversation. Because like you said, without the money, we're not going to get our children having the good health that they need. All right. Sorry, I really am passionate about that topic, so I'm sure because I've spoken a lot, but sometimes we really need to understand how important it is. Okay, Dr. Jumoke, do you want to round up your question before we go on? I think you are back. Oh, you have disappeared again. Temi, are you talking now?
Okay, so can you hear me? Okay.
Yeah.
Yeah. All right. So I was just saying that no.
We can hear you, Dr. Jumoke. Just go on.
Can you hear me?
Yes. I think
hello. Can you hear me?
We can hear you definitely.
Hello.
Hello, we can hear you.
Can you hear me? I was saying that genetics also play. Okay, so genetics play a role. It plays a role. Okay, so genetics plays a role. Okay, genetics plays a role. If you are big, to have a small baby, to predispose the woman to have not big because of
Jumoke, you muted yourself. You muted yourself. Oh my, we're really struggling today. Okay. So Dr. Jumoke said genetics plays a role. So I guess that is what she's trying to say. Somebody say, what as the age can a child visit a occupational therapist? Is that for Samson? Do you want to answer that? Samson, unmute yourself. You are still muted. Oh, this thing can be. Let me see. You got to do it by yourself. I can't do it, unfortunately.
Unfortunately.
Oh, good.
Done.
Good.
Can you hear me now?
Oh, good. Good.
All right. So basically, depending on which stage of development the child is, so we have OT generalists that sees a child in every stage. So depending on the hospital you are, your child is seen. So even from neonates, occupational therapy can also do something with your child in incubator. I'm starting to be, proven by my doctors there. So the posture of the child, there are some child that develop joints even in incubator. So occupational therapy can give them some splints, which I've seen a lot, even though I've not been opportune to work in a neonate clinic, but I've seen it very well. So occupational therapists can work with your child in school in any from 3 years old. For example, a child we cannot diagnose a child that has autism until 3 years old. Research has proven that like until the child is 3 years old, you can now be like, okay, these are the specific function that you are looking for in the child. So depending on which area you want occupational therapy to come in, that's when we will tell you like, okay, OT can come in this age, in this age. So there's no age occupational therapy cannot be given to your child. So I would like you to analyze your question further so that I will be able to give you the response. And OT is not only in pediatric, we have OT in geriatry, in different areas. So occupational therapists work anywhere. So I'm using that to advertise occupational therapy. So it's not only in pediatrics, it's general settings. So, but
Right.
we don't rule out the function of other professionals also. All right, thank you.
Thank you, Samson. All right. So I think what matters is what is the problem. You don't just go see occupational therapists because you just want to see them. There must be a problem. And like you said, even a newborn baby may need an occupational therapist. So, but the doctors will decide when they need those children, and then they will. So it is not like you just recently have to take your baby to see occupational therapist. When it's needed, that is when you see them, and it can be from any age. All right. So Margaret is saying, my doctors, I did mixed. I guess you mean mixed with the X, and 7 months old, taking formula, solid food, stop breastfeeding on his own. What vitamins can I give to him? He's no longer taking breast milk. I give birth to him pre-time. Okay, so I guess this is for the pediatrician, even though you didn't specify. But what I would advise is, if your baby was born pre-time, which is, I guess that's where this came from, your baby must be followed up by a pediatrician till they are 2 years old. So most people give birth to preterm babies and they go home and they think, I don't need the doctors anymore. No, preterm babies have special risk, and they must be followed up by the pediatrician. So you really need to go back to your pediatrician. They need to see your baby. There are drugs we prescribe for preterm babies that we don't prescribe for other babies. There are, like, for example, we put them on iron supplement. We check their PCV because they are prone to anemia of prematurity and so many other things like that. And it is really not typical for a baby to stop breastfeeding by themselves at 7 months. So we really need to evaluate that further. So, and for a preterm baby, you are talking about the brain maturity. There are still other complications that can happen in future. The development is still and is at risk depending on how preterm your baby is. So these are special babies that require pediatricians seeing them. So it's not just about vitamins only now. There are other issues that needs to be involved here. So I will recommend that you see if you don't have a pediatrician you need to now see one, and then so that they can monitor your baby. They can check for other things that can have impact on that child in terms of the future. So that's what I would say to that. Okay, so this question, I think it's a question we've answered already, but she's trying to ask again. That my son weighed 14 pounds at birth, and this led us to stay in ICU for 1 month. What can I do to avoid having big babies? I think Dr. Jumoke has answered that. Dr. Jumoke, see here, Dr. Jumoke has disappeared again, but she has answered that you have to do your genetics and all that. And I believe that if you were there for 1 month, the pediatricians must have told you why your baby was big, what they're suspecting, and they should be the ones to answer that question, what you can do to prevent. And then you still mentioned the same thing as speech and sight test. So, like I said, you were claiming that they do it for developing countries routinely. It is not done routinely. Your baby may have had those tests done if they have reason to do it. For example, if your baby was if your baby was suspected to have maybe a problem in the brain, maybe that was your baby was so big, then they may want to do certain tests. But I just want to correct that impression that newborn babies have speech and sight tests at birth in developed countries. No, it is not. There's no country where they do. The only thing they do is a hearing screening for newborn babies, but they don't do sight. They don't do sight or speech tests at birth, even in developed countries. So unless you mean something else. But if your own baby has special needs and it's in a neonatal intensive care, definitely we want the ophthalmologist to see. We may want other people to see. A speech therapist may have seen your baby for swallowing problem, not because of the speech, but because of other reasons. So I really just want to be sure what you are, but you are generalizing it, which is what I'm trying to correct. Most people have their babies and that's all, and they don't need to do that. Okay, we're not going to answer specific baby questions today. Like I said at the beginning, please post those one on our Facebook group. Today is about general health issues. Okay, this is for Dr. Jumoke, who has disappeared. So young Queen is saying, what's the best position for a faster labor? Is one to follow a midwife that requires one to lie down? Isn't this against gravity? I don't think there's any position for faster labor, even though I'm not an obstetrician gynecologist, but I can answer on the behalf. There is no position for faster labor. Labor is labor. Labor progress on its own, and the obstetrician will monitor you. And if they think that your labor is slow, they can augment your labor. They can give you drugs through drip to make your labor faster, but not about whether you run up and down or you climb steps up and down. There's really no reason for all that. And people deliver the baby in different positions. Some people want to deliver the baby in the hospital. Some people want to deliver the baby in the water. So different people do different things. So there is no special position for any fast labor. It's just about the baby itself progressing. All right, we're rounding up now. Yeah, Dr. Jumoke, hopefully if she comes back, she will take some of those questions. Okay, Dr. Jumoke say, I'm as big as an elephant for real, but my baby are extremely big too. Yeah, so if you are big, that's what Dr. Jumoke was saying. If you are already big, you have the genetics for being big, and then you are likely going to have big babies. So that is common sense. So and there's nothing you can do much about that. Then another thing is that, are you diabetic as well? Because if you are big, you also have a tendency to be diabetic, and if you're diabetic, you're also going to have big babies unless your diabetes is well controlled and all that. So I believe you should have had that conversation with your doctors. And yeah, somebody, okay, I think that's what eBay, yeah, thank you. That's what Sandra was already sending to me privately. And I think that's what the mom is also saying. Yeah, you're right. We're not taking specific questions today. Please post that on our Facebook group. Because if I start doing that, then it will become a pediatric symposium. It is not a pediatric symposium. It is, yeah, okay. Yeah, so this Facebook is confirming what I say, like hearing and sight screening. If baby don't pass them, they won't be allowed to leave the hospital. I guess what you mean is a newborn screening, hearing screen. That's what they do, yeah. But not even the sight. I don't think they do that. Okay, yes, I've unmuted myself. Thank you. I hope you can hear me now. All right. Okay, I guess we are done. No, we're not done. Okay, tomorrow. I hope, yes, we try to tell our professionals to get the best network possible. I guess sometimes Nigeria just happens to us. So, so if you have specific pediatric questions, just post it on our Facebook group. We won't take that today. Yeah, I know you all asked these questions today. With some say you didn't get to reply to your question. Is it one of those pediatric questions? Let me just scroll up. If it's a pediatric question, like I said, post it on our Facebook group. Yeah. We won't answer specific pediatric question because today is a symposium. It's not Ask the Pediatrician Live. It is our health symposium. We have all the questions for the professionals, and that is what we are doing. Sorry, we won't answer your question today because it's about our professionals today, and I don't want you to pick it up to. I don't want to be doing pediatrician live. It is about ATP life. So we finished answering all the questions. Sorry that some professionals struggle with their network, and sorry that we can see Tammy, but Tammy can't answer. They can't talk to us. I don't know why. I would say that all the professionals that couldn't come online, and including patients that have some slides, they can put their slides on the Facebook group for us, so you can read it. And under the post, you can put in your questions, and I'm sure they can answer it directly. I guess that's the best option we're going to do. So thank you so much, all our professionals. I would just like everybody to give a one-word take-home message. Shola is trying to really connect with us, but unfortunately she's not connecting. I don't know why. If you want to give us one word, one sentence take-home message, let's start with Patience. Just your one word take-home message for us.
Good evening. Good evening again. My last word goes to the parents of infants and toddlers. Please communicate with your kids. Speak with them. This will help them develop proper speech and language. Don't stop doing bo 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 da 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 to your babies. Speak actual words to them. They can hear. As long as they can hear you, they can make sense out of your actual words. So stop insulting their intelligence by saying da 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 boo boo. Speak to them. Thank you and good night.
Thank you, Patience. Ibeh, Sandra. We can't hear you, Sandra. Okay, I'll come back. Are you ready to talk to us now?
Can you hear me now?
Yeah, we can hear you now.
Okay, sorry. Thank you once again for the opportunity and for the opportunity. What I'm going to say is children are unique beings. They are not young adults. They have their own specific needs and care. So as parents and in the community, we should try as much as possible to obey and hear what it is they want and report appropriately to whichever health professional and not to our neighbors or to our family members, so we don't end up injuring them. And also pay attention to health education given. It will go a long way for our children. Thank you.
Yeah, thank you. And okay. Tinyan, do you want to say your last word for us? Tinyan. Okay. Okay. Tinyan, can you unmute and talk? Yeah, you're unmuted already. Okay, so Dr. Jamaica sent go on.
Kindly ask a professional if you are not sure
Oh, okay, we've lost Tinyan. Okay, so Dr. Jumoke sent her answer, so I'll just post it as a
Yes.
banner.
Are you
Yeah, you are breaking, but we can hear you briefly.
hear me?
You are breaking. Okay, no worries, Tinyan. I think we got you.
Yes,
So we should
I
ask
said
the professional.
always
Okay, go on.
ask.
Okay, the network is messing up again. We can't hear you anymore.
Professional if you are not sure.
All right, thank you, Tinyan. Samson, do you want to give us your final word?
Yeah, thank you very much. It's actually good to be here today, and the final word I will give basically is to our parents and the government. So, government, we have to keep begging them because we can't do nothing than to beg, appeal to them. Parents, please don't keep your child that is having mental challenges home. Let them come out, reach out. Definitely don't think it's too expensive, you cannot afford it. If you bring them out, definitely you will see at least we'll give you home assignment that you can do. We can train you, can reach out to us, we can give you basic thing you can do to help the child. And government, please help recruit my colleagues so that we'll have more OT. I don't know which of them is listening that can formulate policy. OT role in Nigeria is really, really needed for kids with special need. So that's my appeal for government and for our parents. Thank you, Dr. Boy.
All right, thank you. Everybody has given their final word, so I'm going to say my last job is to thank all the professionals. I really appreciate your time. If we are going to pay you for these 2 hours, going to 3 hours that you've been with us, I'm sure we will not be able to afford you. But thank you so much for sparing your time to be with us. I want to thank you, patients, our speech and language therapists, for staying through all the time. Thank you for your time, your data, your expertise that you provided for us. Thank you, Sandra Ibeh, our pediatric nurse. I want to appreciate you for being here tonight. Thank you for the wisdom you've shared with us and for supporting our children, making us realize that they are not young adults, but they are unique beings. Thank you. So, Tinyan, our pharmacist, who has always been with us and always answering our pharmacy related questions. So, Tinyan is available on ATP. So, if you have any question about drugs, please post it and she will answer it. Some of you were asking, how do you store your drugs? Can you mix it wrongly? Now you are not sure whether you should still give it or not. So Tinyan is the right person. If you post it on our Facebook group, she'll be there to answer that. Thank you, Mr. Samson Dorojaya, our occupational therapist. Thank you so much for the wisdom you've shared with us this evening. Thank you, Tammy, for staying with us, even though we couldn't hear you for technical reasons. I also want to thank Dr. Olajumoke Ogunro, who has shared with us despite the network challenges. Thank you to Dr. Rotimi as well, who also shared with us. And also thank you to Dr. Bukola Olatosi, who is unable to join us. She made so much effort. And also Shola Adeboyejo, our physiotherapist, who was also making effort to join us, but somehow had some technical difficulties. But if assured me that they will post their presentation representation on the group. And thank you to Tammy as well, our BFS therapist. She's also going to put our presentation on the group, and then we can all look at it. And if you have questions, put it on there, and they will answer you. And I really want to finally thank all of you who have listened to us. Thank you. Today is the health panel day, so we're talking about health. And like some of you have realized, we can't talk health alone in the care of children. There are also other non-health professionals. So my job is to invite you for tomorrow's symposium, day 2, where we're going to have other professionals talking about, let me just show you the professionals we're going to have tomorrow. We're also going to have 10 of them, and they are going to talk to you about other issues as well. So please make sure we're going to have the fathers. So tomorrow we're going to hear back from you. So because it's just the professional talking to them, but tomorrow we're going to have our father and the mothers telling us how you as parents are coping. We're going to have our parenting experts. We're going to have our lawyers. We have about 3 lawyers coming tomorrow, and they're going to be telling us their roles from stopping child abuse, from child rights. We're going to have how do we take care of our special needs children. We're also going to have supports, other people who are supporting other professionals, so the educators, the IT specialists, so many professionals are going to be available tomorrow. So please don't forget to join us tomorrow, same time, 6 p.m. and come with your questions. I will be here again tomorrow as well. And I believe that we're going to have a more exciting time tomorrow. So thank you so much. It's ATP 6th anniversary, and thank you for joining our HANA online conference. The conference continues tomorrow at 6 p.m. with our non-health panel. So I look forward to having all of you with us tomorrow. Thank you so much, and have a wonderful evening. Bye. Thank you all our professionals. Bye.
Thank you.
Bye.